My gums bleed all the time.
So normal. Yeah.
It's normal.
Yeah.
What do you think about that?
I mean, obviously, you and I know that it is far from normal, even if it has been happening your whole life. That's a difficult, actually, topic to cover when someone comes in and they're like, my gums have always bled, though. This is just normal for me. And like, even though it's normal for you, doesn't mean it's baseline healthy at all, you know? And now, thankfully, we have solutions like the perio trays or like, you know, whatever you and I do therapeutically in our chairs to stop the bleeding and stop destruction of gum and bone. Because basically, that's just a sign that the patient is actively at risk for destruction of gum and bone. And that's where we want to keep them away from.
Yeah, bleeding gums are not normal. Another one that I hear a lot is oil pulling will cure cavities. I believe it started in India, where they would take some sort of oil, whether it be coconut oil, sesame seed oil, and they would swish it through their teeth. And they say that it helps to whiten your teeth, it's gonna cure cavities, it's gonna cure gum disease. It doesn't.
To your point earlier, like people will spend 10 minutes, you know, oil pulling, but it takes a lot less time to just floss and brush. So, and those we know, according to research, how effective they are. And we also know that like plaque is a biofilm, so a biofilm needs to be physically disrupted. It needs to be physically touched to be removed, and the biofilm is what causes the cavities and causes the gum disease. So without that physical disruption and friction, you're not going to get much result anyway. Like you said, it doesn't hurt, but it's also, if you're going to spend the time, it's better spent with a toothbrush and floss. Yeah.
Another one I was thinking of is when it comes time for the medical history, that has nothing to do with dental. And I tell them, I was like, many times there are medications that you're on that have a direct like correlation to your mouth, especially with your gums, or dry mouth is like the number one like side effect of these medications. So even though they may not think that it's not related, it definitely has some relation. Or like if they've recently had a surgery, sometimes you have to wait a period of time, even if it just is, you know, you got ankle surgery or something like that.
It's definitely related. And then going back to our point about like the pre-medication too, for people who have the joint replacements or have history of the heart inflammation or endocarditis, it's like we need to know for those patients, even though your heart might seem far away, it's really not, it's right there. And also like your joint might seem far away, but you know, what we do in your mouth can directly impact those things. So yeah, we've got to know.